Good morning. This is Steve Stites at the University of Kansas Health System. I'm in the Dolph Simons Family Studio, and welcome back to our program this morning. We welcome a couple of new folks, no, not really new people. One new person, Joe Reardon, who is the president and CEO of the Greater Kansas City Chamber of Commerce, along with Bob Page, the CEO of our health system, and Tammy Peterman, president of our campus, and of course, Hawkeye, who's over in Studio B. As we start this morning, it's been a great weekend. The weather's been wonderful, but this is a big day, Joe, and we wondered if you had any opening comments you wanted to make, because things start to change around the area today.
People and businesses wanting to get back to work, back in the workplace, but we want to do it safe, and we want to be smart, and we want to protect people, our own workers, and those that will be visitors. And the Chamber, for the last 3 weeks, has been working on a strategy to help businesses thinking about how to safely return to the workplace. And we came out with a Safe Return KC guidance last week, a 20-page document that really does a good job of really giving a business guidelines, a sense of what steps they should be thinking about and what steps they should be taking as they prepare to come back to the workplace. And to give you a sense of this guidance, which I can dive into as much as you want, Dr. Seitz, but we think of it as 2 lanes. There's 2 lanes for every business out there. One lane is the government regulatory lane. And that's what's triggering, for instance, today in some parts of the region, some businesses can come back and reopen, whereas other places that's not yet the case. And then in the other lane is where our guidance sits, which is once you get the direction from the government about the date you are going to open and what things are mandatory, how do you operationalize that? What do you think about in your own workplace that needs to be done to be safe and to be thoughtful and cautious? And that's really where our guidance comes in. Not on the government side. They're going to make those decisions. The regulations are going to be there. But it's really helping that business, small and large, to think through what really needs to happen in order for you to be safe in the workplace coming back. And much like what we see in many of the governmental plans and what will end up being ordinances and laws, ours is a phased approach. So not all at once, but careful steps that can mirror the kinds of phased approaches that you're seeing the government mandate in many of the plans that are coming out in this Kansas City region. So that Safe Return KC guide is available on our website, kcchamber.com. And again, I'm glad to dive into it a little bit, but I know we're just getting our conversation started.
You bet. And Tammy, we've been open throughout this, but today is also a big day for the health system.
Sure it is. First of all, the Safe Return KC guide is great. I took a look at that earlier, Joe, and I thought it was safe and thoughtful. So thank you. I know that'll be a really important resource for a lot of people. I think the Chamber actually connected with some of our infection prevention and control experts on that document as well. So thank you. I think that'll be really important. You know, as businesses start to gradually reopen in a safe and thoughtful way, I was thinking about this, and what I know is that healthcare organizations have remained open. And we've done that in a safe and thoughtful way. And I was looking at email earlier today, and we have something in our hospital called a mark to zero harm. You know, it's a zero harm scorecard, making sure that we're always looking at everything from falls to infection rates. And we have focused on that every day, not just the last 7 or 8 weeks. We've done that every day for the last many, many years. And I think that's what healthcare organizations have been doing. We've been taking safe care of patients in a quality way for a very long time. We know how to do this. So as we continue to see more patients and our volume continues to grow, we'll do that in a really safe way going forward as well.
Yeah. Bob, safety's been our hallmark for a long time.
It has, Steve. And back to Tammy's point, I mean, during this entire crisis, we've watched our census, and we're probably around 500 patients a day. Now, at the max, we were 800 to 900, but still, if you're running 60%, so it's not like we closed. And our hallmark has been 2 things. It's been a focus on our folks, and it's been a focus on safety. And I think we've been true to that throughout this entire crisis. We'll continue to do that. We all keep hearing these stories about people who are staying at home. We're hearing about more strokes at home. We're hearing about more heart attacks at home. I'm not a clinical guy, but I'll tell you, that's just something we can't We can't allow that to continue. We've got to encourage our friends and our families and our loved ones that you can't forego necessary health care. And it doesn't matter where you get your health care, you need to get back into the healthcare system because we're all working on safety.
They are. And Dana, last night we are through the weekend, a beautiful weekend, but yet our COVID numbers crept up just a little bit. Any thoughts about that?
Yeah, they did. It's unclear. Certainly we're waiting for the over the weekend numbers from the state and from the city overall. Some of these numbers may be from patients in other counties who are being transferred. Yeah, currently we are at 31, which is, 10 more or so than we had for the most part of last week. We have 15 of those in the ICU and 5 on ventilators. I'm hoping that this creep and this, I don't want to say a mini surge, but certainly a creep is something that can be tempered down, and we can continue to see lower numbers than we have been in the last few days, and more to the numbers of we were seeing last weekend.
Joe, it feels like to me the thing that drives the numbers here locally and really nationally are the little hot spots that add up. There's a little bit of community transmission, a lot of community transmission, but that doesn't seem to drive census. It's when you get a major outbreak with a close gathering of people. Safe KC in our area. Talk to us a little bit about some of the specific steps that you've put out there that businesses can help do to keep their employees and their customers safe.
Yeah, that's a great point. And I'd say, when you look at how to think through this, our guidance, the 20 pages, really is at the highest level. And every business is going to have to look at the unique nature of what they're doing and how they're conducting business to really sort of operationalize guidance. One of the things that we've learned, I think everybody's seeing this, but if you're in an office environment, we're learning to be productive while not being physically present in that office, which is quite amazing. And tools like Facebook, which we're on today, and Zoom and the screen-oriented sort of thing, which I was not used to at all prior to working from home, is absolutely unbelievable how productive we can be. And so part of the guidance we have in the very first phase is if you are continuing to be productive without being in the workplace, stay in that environment where you're working from home. We think that's very practical. We've talked about it in our own office. There's 33 of us. If all we're going to do is come back to our workspace and be on Zoom with one another in the very first phases of this, does that really make any sense at all? And I think that we've got to all think through that. But we, at the very fundamental level, we think there are 5 things that every business ought to do. That the business ought to learn about what's out there relative to guidance around coming back into their kind of workplace. And we offer some of the direct links to those kinds of things in our guide. And then listen, we think it's very important for every business to communicate both collectively and individually with their own workers and get a sense of where they are and understand what's going on with them, and in a way that a business can do, staying within their lanes legally, which we offer some guidance there too. And communication is really important, communicating to your workforce, but communicating to the public as well about expectations around the business and what will be happening there, and being careful about outlining that. Then in evaluating your workplace, taking a hard look at it and understanding, can you practically do social distancing? Do you have to put up barriers? If it's the kind of business where PPE is going to be essential and required, are you finding adequate sources for that? And we're offering some links to sources that are around that. And then finally, it's to actually do that preparation within the workplace, to prepare it for as safe an environment as you can have while returning to work. So those are the 5 fundamentals. And then under all those 5 fundamentals, you go through a 3-phased approach in our strategy. And phase 1, of course, is the minimal reopening, where you're not having any external folks visiting, if at all possible, and you're limiting gathering in any number at all. Dr. Stites, as you said, it seems like these gatherings are where hotspots can occur. And so in our phase 1, gatherings are discouraged altogether, and working from home is very much encouraged. But we think that it's really important to take this in a phased approach. And we're in a really, even though things are opening, this is a cautious time for us as individuals, we believe, but also for businesses as well to be smart.
Yeah, it sure is. And no matter how you do it, it's still about the 6-foot rule, washing your hands, don't go to work when you're sick, cough into your elbow, and wear a mask when you're out in public. So those are still fundamental principles, whether you're in business, healthcare, or however you want to conduct your personal life. So as we talk about that, let's turn to our media and ask if they have questions this morning. I don't know, Nate, did you have anything from Facebook?
We are getting some questions. Let me see what we got this morning. Somebody was asking, wanted to know what the average age of our new patients are. I assume the COVID-19 patients.
Dana can probably help us with that.
Yeah. I don't know that we have those numbers particularly. I can say, and we have stated before, that this infection will affect people of all ages. Certainly, if you are above 50 or 60 or 70, you have a higher risk of being hospitalized, but we have seen all ages from early 20s, up to 80s. So I don't think we have those numbers per se right now on the average, but we are seeing just a large range of ages. And people are coming into the hospital, even though they're young and otherwise healthy.
Yeah, we do know that the average age of those who have passed away from COVID-19, though, tends to be older. It is higher than 70. And we do see some racial disparity here in the patients that we have. And actually, that's a topic we'll be addressing later this week on Wednesday when we get into some of the demographics of what we're seeing here with COVID-19, both locally and nationally as well. So, Nate, other questions or anyone else?
Nobody else has any. Somebody was asking if we were able to speak to the COVID-19 symptoms that we're seeing in children, as some of them seem to be different than in adults.
Well, first of all, they may not have symptoms, so they are different than adults. But they also have a little bit more sometimes of upper respiratory stuff still. Dana, other thoughts?
Yeah, absolutely. I think the main concern is that a lot of them could be asymptomatic or very mild symptoms, just as you said. I'm not aware that we've really seen too many of the pediatric patients here as compared to if Children's Mercy has. But just as you said, in general, the pediatrics, luckily tend to be spared as far as symptoms and severe infection. But unfortunately, they may have very light to no symptoms and can then therefore spread it even easier because we don't know that they're sick.
It's an interesting question to take that on a little bit and ask Joe and Dana together. Any special precautions we should be doing as businesses reopen as far as having kids come into shops or places like that? Have we talked about that one?
We don't have anything specific in our guidance around children, but I will tell you in our first phase, we discourage visitors of any sort coming into the workplace altogether. So in the earliest phasing of our guidance, we're saying that if you can bring your business back up and operating in the workplace, doing that without outside visitors is the safest way, the most cautious way to enter into phase one. And I do want to mention, and I appreciate Tammy bringing this up, the guidance that we've put together reflects the knowledge and information of reviewing over 50 plans, working with local experts like those at KU that we've been able to consult with, attorneys and others. So it really is, it's not kind of coming out of thin air. It really is sort of the best knowledge that we could gain both nationally, but also speaking to our experts right here in Kansas City too.
And Tammy, one of the things we've had to do is make sure our employees stay safe.
Absolutely, and we've talked about this. I think we've talked about this. Steve, you do this pretty regularly as well. And we do everything we can, as we always have, to make sure we have a safe environment for our staff, a safe environment for patients, and when we had visitors, we don't have visitors in our hospital anymore. We If any of you have ever been to our place recently for any reason, you know that we screen everyone when they come into any one of our doors. So everyone is screened every time they come into our organization. We make sure we are tracking our PPE. We know that it's very important to make sure we have the right protective equipment for our staff. And we have teams who are making rounds to make sure that we are managing that social distance. I think, Joe, that's probably one of the things that when businesses do start to open, that they will have to pay close attention to, because it's really easy to kind of, get back into your norm and get a little closer together. That's what people do. We have to maintain that distance. And that's one of the things we work on a lot here.
We've been talking to our own staff about this, that, we've seen one another on these screens now for 6 weeks, but when we come back to the workplace, we'll be seeing one another for the first time physically in a long time. And I think the temptation will be to break right through that 6-foot barrier, right? I mean, it's almost human instinct to want to be closer than 6 feet. And so that's a really important thing. And that's why we think communication is so very important. And part of every phase of our plan is to reinforce those smart things that you have to be doing and conscious of at all times, for sure.
It is true. My wife and I were walking this morning, and we're thinking, now, what is it that we miss most? And we both said hugs from our kids.
Yes,
because
I know.
It's just you want to be able to have that, and then the other thing this weekend, I was on a phone call with a friend of mine whose parent is a patient here, and who was going to move to Comfort Measures, and struggling with whether they can come up and see folks. We don't have visitors, but in that situation, we still bring people in to see their loved ones as they move from aggressive care into Comfort Measures and are looking at the final days or hours of their lives. So we do have some exceptions around those things.
Well, and I think our team has just done this remarkable job. I was reading an email this morning from one of our nurse leaders who talked about a scenario when a patient needed really, or the family wanted to have a conversation with their loved one, and I think they got just 8 or 10 people on a Zoom call so that everybody could see that patient and see the progression, the positive progression of that individual. And I think it's so reassuring. It's hard. We hear from patients' families a lot how hard it is, and I can't even imagine. And so what we try and do is just make it as real and communicative as we can through Zoom and FaceTime and other things.
Yeah. Other questions from out there, Jill?
I have a community member who's concerned about backlog of getting in to see the clinic and their doctor, and if they need procedure, and they're wanting to know what measures we're doing to decrease the wait times.
You bet. Well, we can probably take that on. And one of the things we've already started doing is calling patients to bring them back into the health system and have them see their physician. Last Friday, I believe we saw today we're seeing 4,200 outpatients. Our normal is about 5,000 outpatients. So we're getting right back up there. And that's a combination of televisits and in-person visits. So I think you'll find that we're trying to get through that backlog, surgical backlog, the same way. I know we're working through that and bringing patients in to have their surgeries done. So starting with things that are more urgent, and then we'll move eventually into more elective cases. The funny thing is that in medicine, there aren't truly that many things that are purely elective. There are a lot of things that may be not as urgent, but there aren't that many things that are purely elective. And if you can't see, removing a cataract doesn't really feel elective. And so I think that there are just different grades of that.
I think that's right. And if people have individual questions, they should call their provider, their clinic, because they will work with them to get them in, whether through telemedicine or a face-to-face visit. And we have ways that we're doing that now. It'll look different. It'll feel different. There won't be as many people around at all, which is the intention. And they'll go right back to the exam room. So we have all of those practices in place. We've changed our workflow.
Yeah, and we think eventually we'll have longer hours during the day, and we'll be working more on weekends in order to make sure we can see all of our patients and not have that congestion. And even when you come in, for example, to our medical office building, there's now an incoming entrance and an outgoing exit, and that way you don't mix, and you don't everybody's kind of moving in the same direction to keep people safe. Other questions out there?
I have a question from Newsy.
Newsy.
And they want to know about herd immunity and how many people have to be infected to reach it.
Well, approximately a lot, Dana.
Absolutely. Yeah, we would prefer, sorry, if you can do 70 to 80%, but I think really more than that is 85 to 90% or more for herd immunity, because the concept is that if you have all these people who have been infected or who have immunity, they can spread it to less. Obviously, if you only have 50% of the population that's been infected, you have a large number, still 50% who can still be infected.
And this is why immunization is so important, because if you can do that, and that's why we can usually control the influenza outbreak partly, is because of the flu shot. And that way it's harder for a virus to jump from one person to another person if that other person has immunity. If 8 out of 10 people that virus encounters have already had it, it's defeated. And that's really what makes the difference. And as Dana said, you really want to get way over 50%, and the higher you go, the better off you are. And clearly with COVID-19 or with SARS-CoV-2, we'd rather do it through vaccination than through direct infection. But hopefully that we'll see that relatively soon. Other questions? Nate, anything else that you're seeing?
Yeah, we had an interesting question. Somebody was wanting to know that in terms of precautions after being out in stores, for example, do we think that it's going to be necessary to change clothes when we get home?
All right, Dana. I've been to the store. I go to Home Depot, go to the grocery store. Do I need to go home and change out of my bodysuit?
My initial answer to that is no. I think that you would definitely, most people are going to be wearing a mask at this time. You definitely want to use alcohol sanitizer as soon as you're able to get into your car or out of the store, or also wash your hands as soon as you're able to get home. Some people take the precaution of taking off their shoes when they get home from the store. That's reasonable too. But I don't think that there's really a need to be changing out of your clothes into a new set of clean clothes. Obviously, if you're around and you're close to people, which you shouldn't be, you should be apart. And if you have some, direct sneeze or something like that, that gets onto your clothes, that might be a different story. But in general, just going out to the hardware store or the grocery store, the most important thing is going to be washing your hands and certainly not touching your face, and washing your hands as soon as you get home.
What about spraying down with Lysol?
Spraying down with Lysol?
Yeah,
Probably
that's
not.
a bad idea. What do you think? Yeah.
Yeah.
So, just as a reminder, on Friday, our IPAC team, Infection Prevention and Control team, is going to be here. And we'll talk about some of these direct questions, because as we do go back out in public, we want to kind of do a refresher course with everybody on what we should do. Other questions?
A question for Dr. Hawkinson, back to a little bit on the herd immunity thing. Have you seen the numbers out of Johnson County on the ratio of positives that are coming back? I think over the weekend, it seemed to have dropped a 1.5% down to the 7 range. Shouldn't at this point we be expecting to see a lot more positives from the testing that's going on out there?
Yeah, I think that is, and this kind of goes to something we were talking about earlier too. You may have these other hot spots. I have not seen the numbers out of Johnson County. Dr. Stites may be able to speak to that more. But in general, we could see a lull in testing as far as positive results, or we can see spikes just depending on when people are getting tested, exactly who is getting tested, and things of that nature.
I think part of the struggle around testing is we constantly move the ball over why we're testing someone. So it's when we didn't have many tests, we reserved those for inpatients largely. So a lot of them were positive. As we moved out and we're starting to do more tests, then on any given day, if you should have more negatives. But then if you go do a nursing home or an area where you're suspicious there's an outbreak, then your percent positives are going to go up. So the ball's going to constantly move, and I think I would be a little cautious about trying to follow the percent positives, especially small movements in the percent positives from one day to the next. If over a month's time there's a big difference, then that's meaningful. But a day-to-day measure when we constantly change our testing criteria, probably not as meaningful. So a lot of it just has to do with how we're administering the test and what patients are we picking to test. Other questions?
Yeah, I had somebody who was curious to know what was the highest number of COVID-19 inpatients we've had at any given time.
Yeah, it was 39 is that number, 39. Yep. And so I think today you said we were at 30. Well, we don't know today's, maybe yesterday we were at 31. So we had gotten as low as back into the high teens again, and then we're back up to 30. And a lot of that just has to do with an area that might get infected. Again, if a nursing home or a food processing plant or something, any kind of hotspot around your area turns more positive, then what happens is the hospitals around that are going to have more patients. And so you see, we call those mini waves, and they're really small fluctuations in what is going to be a COVID baseline. I think it's just important for us to realize COVID's not going away anytime soon until we have vaccination or therapy. And as a result, what happens is we're going to have a certain number of patients, and it's just going to vary within that category until we see COVID either treated or vaccination, herd immunity, or it begins to go away.
But
So,
Steve, isn't one of the other things, though, the number of ventilator patients we've had? Because that has stayed relatively stable. Now it's at 5, but it was 10 to 12, but not much higher than that.
No, we've never had the crush of ventilator patients that we were always afraid of. Exactly. Other questions?
There was a question for our chamber guest. Somebody was wanting to know what kind of financial losses is the greater Kansas City area facing from COVID-19?
Okay, Joe, you get the hot question of the morning right there.
Well, I think it's safe to say that there'll be substantial financial impact from this, but no one knows the full extent of that yet. You certainly are going to see an economy that has been damaged by this, and the big question will be, what's recovery look like? How quickly can recovery come? I think there's some practical realities around that, as Dr. Stites said. COVID-19 is going to be with us for a long time. And businesses, there is going to be, I know this is sort of a catchphrase, but it is going to be a new normal. And we're all going to have to figure that out in order for us to continue to have the economy grow in the right direction. I think the second thing, though, that's encouraging about Kansas City is we're a pretty diversified economy relative to other regions. And so I think you will see that the hit to the economy won't be as extreme as some other places. And our recovery will be a little bit more steady, probably not as extreme the other way. And that's always sort of been Kansas City's fundamentals, right in the middle. The one thing I did want to mention, Dr. Stites, if I could, is that we opened up last week when we released the Safe Return KC guidance, a virtual help desk at the chamber. So if there's businesses out there that have more specific questions about their operation or they need more information, we would welcome them to reach out to us at our email, which is helpdesk@kcchamber.com, helpdesk@kcchamber.com. And a lot of times what we've experienced already in the businesses that we're helping, sometimes we'll have an answer directly for them, but other times they may have questions that we can't answer appropriately, or maybe they're more on the medical side and ones that they need some more direct consultation with. And I know we've been talking to the health system a little bit about being able to refer businesses to them to assist with those kinds of questions or issues. And I think that's going to be very important, because part of what we're doing is getting the questions or the issues, but then getting that business to the right place.
Yeah, so we say business as usual, but really that's not true anymore. It's business as new. It's a whole new day. Yeah.
Even our last phase, says that business has changed, and you're not going to go back to normal operation, at least for the foreseeable future.
Yeah.
Okay, I have 2 questions. The first one is, you ask us to give plasma. Is it safe to give the plasma, and is it safe to donate blood?
You bet. Dana? I know it's safe.
Yeah.
The Kansas City Community Blood Center does a great job of trying to make sure patient safety is intact.
Yeah, absolutely. The Community Blood Center will not take any blood or donation when you're ill, and that's nothing new for them. But in general, we are working on a trial with the Mayo Clinic for treatment using convalescent sera or plasma for people who have been infected and have recovered. And you can call the Community Blood Center for information on how to donate. The other thing is that as we see in these times of trouble, and a lot of times the blood products are very low as far as supply. Certainly this pandemic has hit the blood supply low as well. And so the Community Blood Center is also partnering with our university partner, the University of Kansas Medical Center. And there is some space that is been donated or is being used here on campus that you can use to donate blood or plasma for in working with the community blood center. You can either go online to savealifenow.org /group and put in the group EY, or you can call 877-468-6844. We vitally need your blood and plasma. The patients, your loved ones, vitally need your blood and plasma. So please get in touch and try to donate if you can.
And it is safe. I mean, the Community Blood Center does a great job at maintaining a strong infection control environment. So I don't think anyone needs to be concerned about that. Again, that's one of the safer places I think you can go. So there's a second question, Jill.
Yeah, this one's a sports fan. The NFL is reportedly expected to move ahead with their season in September with possible contingency plans depending on the threat of the virus. Is it a smart move by the NFL?
Oh, yeah. Let's say, let's answer that one, Dana. Joe, what do you think as a business? Or Dana, I'm going to follow up with that. And then Bob, you and I have a comment for that, I think.
I would say that our guidance doesn't get specific enough to probably give any solid advice to the NFL or any other professional sport. I think that's more of a question probably for you, Dr. Stites, relative
Probably is. I was trying to ditch, but dodge. Dana, what do you think?
I think we have the three smartest people to answer that question sitting right there. You and your guest, Dr. Stites, are probably going to be the best people to answer that. We can answer that as a pure medical profession and what we want to do in a public health setting. But I think, again, it's going to be one day at a time, and we will hopefully be thoughtful and coming up with those answers.
You know, I would just say I think it's going to be about testing. If you can have a regular scheduled program where the players are tested multiple times throughout the season, and maybe it's weekly, maybe it's 3 times a week, I don't know, and hopefully we'll have salival tests that are really good at that point, so that you know the players are negative, then I think you can markedly reduce the risk. I don't know about having fans inside a stadium unless you can really maintain a lot of social distancing, and that would kind of make Arrowhead a big cavern, but I'm hopeful that as we get to vaccine and therapy, that story will change pretty dramatically. In the meantime, we're left having to watch sports programs. You told me about a great program last night, Bob.
I did. Let me take a shot at that question, though. I think, as any business ought to be doing, you have to be prepared. So if the NFL wasn't making preparations right now, I think that would be a mistake. I mean, the season starts in September. It's May. So any good business is going to be trying to figure out what the future holds. And I think a 5-month window or 4, whatever the number would be, makes perfect sense for people to come up with plans. I talked to Steve last night, and I said, hey, if you get a chance, there's this unbelievable E60 episode, and it's really a story about Alex Smith. And for anybody who ever had a chance to get to know Alex, what an unbelievable guy. And his story, now if you've ever had leg problems, I wouldn't watch it. But I will tell you, I wouldn't watch parts of it, but it is really inspirational. I mean, it's an unbelievable story about a guy who, quite frankly, wants to come back and play.
Yeah, he's always been a class. I mean, we all love Patrick Mahomes, but we love Alex Smith. He's a class act, and he is just a real person, and that I think just comes through his love of family, his love of life, and during this COVID-19, it's kind of good to see inspirational stories. That is an inspirational story.
Well, the Super Bowl was back on again on Saturday.
Yeah,
that was kind of fun. And the Chiefs won again. It was great.
It was
I like
awesome.
that. Yeah.
It keeps happening.
Yeah.
All right. So tomorrow we have a special presentation because Alan Greiner, who is the medical officer for the Wyandotte County Unified Government, and Joe LeMaster, who's the public health officer for Johnson County, will be joining the conversation. And we're going to talk about public health measures, some of the key challenges facing both of our counties. And I think that'll be really informative, and invite you to be a part of that. So as today winds down, Joe, any last messages you would like to leave us with?
I think if we're cautious and we're thoughtful and safe, we can start to go back to the workplace, following the guidance of the health experts, and using good strategies and plans. Businesses will have to be doing things they've never done before. We're hopeful that our Safe Return KC guide can assist with that. And if there are questions out there, helpdesk@kcchamber.com. We're here to help businesses as they think through this.
Dana?
Yeah, I would echo Joe's thoughts. You know, as we get further into this and doing this one step at a time, it's going to fall more and more, and it continues to fall more and more on individual responsibility, doing those simple things that we ask. Do not go out if you're ill. Wash your hands or hand sanitize frequently. Don't touch your face, cough into your elbow. Only go out if it's essential. Because moving forward, those are going to be the biggest things, and staying 6 feet apart, doing your physical distancing, so that we can continue to get into this new normal and get back to business as new.
Yeah. Tammy, what thoughts?
Well, I think that Kansas City has just done a great job. I think if we look back over the last 6 or 8 weeks, we can look really and be proud of what Kansas City has done. I think we have bent that curve. We talked about it for weeks, and I think we've done a great job as a city. I think we'll do a great job as we gradually start to reopen some of the businesses. We'll do it in a safe and thoughtful way. I think resources like what the Chamber and others have put together will be really important, because I think our city we're proud of our place and we're pretty protective of our city. So I think we'll do a good job as we move back, and just know that healthcare continues to be open, and we'll continue to focus on taking great care of all of our patients.
Bob?
One of the things I love about Kansas City is just this community spirit. And first of all, a big thanks to Joe. Joe, we as an entire city ought to be just grateful to you and your leadership team for everything you do. But it's also been an opportunity to watch Joe Reardon and Tim Cowden and Mark Hill with the Civic Council and KCADC and the Chamber to come together with one focus, and that's what's the right thing to do for this community. So I love watching that collaboration, that partnership, and I think it's what really makes Kansas City stand apart.
This is a great city. I'm born and raised here, and dearly love Kansas City. And we started saying early in the program, BKC, because we know that we can do great things. And one of the best things we can do is still take care of ourselves and our community. And even as we reopen, remember, nevertheless, even though things are open, there's still no place like home. We'll see you tomorrow. Thanks.